Hi everyone, my name is Dr. Jessica Ray and I'm from Radiant Life Chiropractic in Edmond, Oklahoma. Make sure my volume is up here. Okay, we're just going to wait a few minutes and let people jump on here. So just a little bit about myself. I am a certified Webster practitioner in Edmond, and I'm also certified in prenatal and pediatric care through the ICPA. So I see a lot of moms and a lot of kiddos in our office. So this is my first webinar, so forgive me if I mess up. But tonight we're going to be talking about the benefits of chiropractic care during pregnancy and a lot of the common questions I get about chiropractic care during pregnancy. So I'm pulling up my notes here. So one of the most common questions that I get is pain normal during pregnancy, and when should I start getting care? So I always tell people it's better to start care sooner rather than later, because being in pain is never normal. That is your body's way of telling you that something is wrong. And so taking care of that sooner rather than later is always better. And also, your body is rapidly changing during pregnancy. Every day your body's changing. Your baby is growing so fast, and your center of gravity is changing. Your muscles are being pulled in different directions, and so it's always better to get that taken care of sooner rather than later before you start to have a lot of pain. And it also gives your baby a good position to be in during the whole pregnancy if we can keep your body moving properly. So, although you may be feeling some discomfort during pregnancy, it doesn't have to be normal. So you can get care through pregnancy, and you can have a good pregnancy where you don't have to be in pain. Pain is not normal during this time. So working out the muscles along your back and your hips and getting a gentle adjustment during this time can make all the difference in your comfort level. So common symptoms that I see during pregnancy, one of the most common symptoms I see is low back pain and pelvic pain. So you may have had low back pain prior to becoming pregnant, and the pregnancy may have worsened this pain, or low back pain may be a new experience for you. So as your body shape changes, strain is placed on your lower back, resulting in changes in your normal low back curvature. So this may result in tightening of the muscles, muscle spasms, pain, discomfort, and all of this can result in misalignment of your spine. So misalignment of the spine is normal during this time as the curvature is changing as your belly grows. So this can occur daily. So this can also result in dull, achy to sharp pain. So research shows that an estimated 50% of women will experience low back pain during their pregnancy or during their postpartum period. There is a difference between pelvic girdle pain and low back pain. So low back pain typically occurs along the low back and the spine area, while pelvic girdle pain typically occurs around the hips and the tailbone or your sacral area. So symptoms of the pelvic pain may feel sharp, you may feel stabbing, it may be one-sided or both pain, both sides may be in pain. It could be constant and could come and go, or it could be radicular in nature, which means you may be feeling numbness, tingling, pain, or weakness down into your legs. It could be one leg or both. So occasionally, I do see women that are experiencing extreme pain and tenderness around their pubic bone area while they walk. This pain can be debilitating and making daily activity very difficult. So pain along the pubic bone is no fun, it's no joke, it can be very, very painful. So, let's see, where am I at in my notes? So this pain can be experienced at any time during pregnancy, but is generally more often towards the later part of pregnancy, especially as the baby becomes lower in the abdomen or starts to drop. So this is applying the extra pressure along the pubic bone area. So round ligament pain. So round ligament pain is one of the most common symptoms that I see with moms, especially towards the end of their pregnancy. So the location of the ligaments can be found towards the bottom of your growing belly. So a lot of you don't know where your round ligaments are. You have two round ligaments, and they attach to the front parts of your hips, and then they meet in the middle and attach to the uterus. So their goal or their job is to hold the uterus in place. So you can imagine as your uterus is growing and that baby is moving and kicking around, those ligaments, they can spasm just like a muscle can. So you're going to feel knots up and down those ligaments, and you may feel a lot of tenderness along the bottoms of your belly where the ligaments are. So this is a very, very common symptom that I see, and this is where Webster comes into play, which we'll talk about in just a minute. So Webster Technique is a technique that's used only during pregnancy, because your round ligaments are almost non-existent when you're not pregnant. When you're pregnant, they get to be pretty large. They can be about as big as my finger, and so they can be pretty large. And so this is where Webster comes in. So And the goal of Webster is to reduce the tension felt in the ligaments around the uterus and the pelvis. So in my opinion, Webster is one of the most important things that you can have done, or your chiropractor can do for you during pregnancy. So if you think about it, if the ligaments attach to both hips, and I adjust the hips, but I don't take care of the spasms felt in the ligaments, they're just going to pull your hip right back out. You won't ever hold your adjustment, or you won't hold it quite as well as if you also had the muscle work done and the Webster done. It all works together because it's all connected. Let's see, so many times this area is so tight that most of the visits that I have with my patients are spent with doing Webster and releasing these ligaments. So taking proper care of the round ligaments is very important in maintaining proper alignment of your pelvis. So another symptom that I see during pregnancy are headaches. So you get a lot of headaches, you get a lot of hormonal headaches during pregnancy. So taking gentle care and releasing the muscles along the base of the skull can be really, really beneficial for relieving those headaches. Another common symptom that you may see during pregnancy is rib pain. So I often see women for rib pain. We as women we tend to be a little weaker along our upper and mid backs. Not to mention the countless purses and bags and children that we carry on a daily basis, and we typically carry them on the same side. I'm left-handed, so I carry my purse on the left side all the time. Over time, that depresses that left shoulder, or whichever side you're wearing that bag on, and then the ribs can contort, and so we don't typically have stronger muscles to hold those ribs in place. So rib pain can often be identified by having a sharp or dull ache when you're trying to take a deep breath, or when you're trying to take a deep breath, it may be hard to fully expand your rib cage. So that could be an indication that you might be having some rib pain. So adjustments typically resolve the pain, but at times myofascial release is needed to reduce the muscle tension between the ribs. Sciatic pain. Sciatica is huge during pregnancy. I see this often, and it is something that can be taken care of. You don't have to live with sciatica during pregnancy. So sciatica is a radicular syndrome, meaning it's irritation of your sciatic nerve, and it can lead to pain starting in your low back or your pelvis and traveling into your buttock area, your hip, and your thigh. Symptoms of sciatica may include come and go or constant pain, traveling down into your legs. You may feel a burning, a shooting, numbness, tingling, weakness into your legs. And sometimes it can be difficult to walk, stand, or sit with sciatica. So irritation to the sciatic nerve can be caused by lumbar spine conditions or low back conditions. This could be maybe a bulging disc, spinal narrowing, osteoarthritis, degenerative disc disease, but this can also be huge during pregnancy because your muscles are moving in so many different directions. It's hard for your pelvis to stay in place, and so sciatica can come along from that. The relaxin hormone. This does exactly what the name implies. It relaxes the ligaments during pregnancy. So this prepares your body for delivery. So as you get further along in pregnancy, the more relaxin hormone you have in your body. And this slowly relaxes the ligaments and the tendons and the muscles and the joints to help prepare you for delivery. This in turn also makes it a little more difficult for you to hold your adjustments, because you're so much looser, your joints are so much looser. And also it's a reason too why when you're pregnant, a lot of times you don't hear the popping noise that you typically think of whenever you see a chiropractor, and also why the adjustments during pregnancy are incredibly gentle, because you don't need much pressure when you're pregnant because of this hormone. So I often get asked, how often do I need to get adjusted? And this is a question that could be answered in so many different ways. Everyone responds differently to care, and so everyone is a little bit different in our office. So while pregnant, you generally don't hold your adjustments quite as well as when you aren't pregnant because of that relaxin hormone. So because of this, I recommend that you get adjusted a little bit more often. In my experience in treating my patients, I have seen great results with getting adjusted every other week until you hit around the 35-week mark, and then I start usually seeing my patients once a week, and then as they get closer, maybe twice a week, depending on how well you've taken care of yourself throughout pregnancy and how you're feeling at that point. So I will get a better idea of how long the adjustments are lasting for you, and we can base the frequency of care off of that. So I always tell my patients, you know your body better than I do, so together we can figure out what works best for you and your body. Another question I get is, do the adjustments hurt? So getting adjusted during pregnancy is incredibly gentle. Due to the relaxin hormone, your joints move much easier and with much less force or pressure than when you're not pregnant. So many different techniques can be used to adjust your spine. I can discuss each option with you. Most of the time for my moms, I have a pregnancy pillow, so the middle is cut out for you to lay face down, and baby is nestled nice and soft and safe in the pregnancy pillow. Most moms love it because they haven't laid on their stomach in months. And so I'll have you lay face down on the table if you're comfortable with that. And then just gentle manual pressure on the hips and low back to get those moving. And then there's also the activator, which is a great option for rib pain. It can also adjust the whole body if you prefer that, but it's so gentle to get adjusted during pregnancy. All it takes is very light pressure to move you in the direction that you need to go in. So another question would be, is chiropractic care safe for a baby? So a gentle adjustment while pregnant is safe for you and baby. So ensuring your hips are properly aligned and the muscles of the low back and hips are relaxed, this will allow the baby to have more room to move around and get in a better position. So babies actually like it whenever your mamas get adjusted because it gives them more room. Should you be exercising during pregnancy? This is a huge question, and the answer is absolutely yes. If you were not exercising prior to becoming pregnant, gentle exercising is best. This can include gentle yoga, water aerobics is great, and walking is really amazing during pregnancy. So I recommend at the very least doing those to all of my patients. Let's see. So typically when my patients come in, I customize a workout plan for them. I have an early pregnancy protocol that I put together and a late pregnancy protocol. So I have them target different muscles depending on where they're at in their pregnancy and what is needed out of them. So these may include gentle stretches. Some of the exercises that I love for pregnant moms to do are bridges. Leg raises are really wonderful. I recommend yoga to all of my moms. So exercising is definitely important. It will help you prepare your body for labor. It'll help your recovery post-delivery, and it will help your adjustments last a lot longer. There are things that you can do at home to help with these symptoms and to help you hold your adjustment between visits. One of the best things that you can do is buy an exercise ball if you have one, or a birthing ball. So this is amazing during pregnancy, and I tell all my moms to get one, because if you sit on the ball, you have to make sure you're staying in good posture and you're paying attention to how your body is, or you'll fall off the ball, right? So it makes you a little bit more mindful of how you're sitting and how your body is. And plus it'll give you a little bit, it'll give you a little bounce, so you can slightly move your hips, move your muscles around, This will help you stay loose, it'll help baby stay in good position, and it'll help you hold your adjustments a little bit longer. You want to avoid sitting on a fluffy couch or a fluffy chair, because as you have to strain to get up out of those comfy seats, then you can easily throw your hips out during pregnancy. You gotta love that relaxin hormone. It's so easy to throw your hips out. So sitting on an exercise ball or a more firm chair is amazing. An exercise ball is also really, really great for sciatic pain. Let me see, where am I at? Okay, I think that's about all that I have. So let me know if y'all have any questions. I'll be on for a few more minutes. But yeah, prenatal care is so, so important, and it can be great for you and baby. It's extremely gentle, and it's just wonderful, because chiropractic care, and we talk about nutrition, we talk about exercise, we talk about structural care. So we look at the body as a whole and make sure that everything is functioning great to give you the best pregnancy possible. So let's see, do we have any questions? Well, I hope that all of y'all have had a great night, and thank you for watching. Bye.